pleasant good day, everyone. The Honorable Terence Dayal Singh, Minister of Health, Betty Ann Pilgrim, Nursing Administrator, and other senior representatives from the Ministry of Health, Mr. Davlin Thomas, Chief Executive Officer of the North Central Regional Health Authority, and other senior representatives from the NCRHA, including Dr. Don Martin, Medical Chief of Staff of the Couva Hospital, the Couva Hospital and Multi-Training Facility, Dr. Stanley Giddings, Infectious Disease Specialist Consultant and Medical Chief of Staff of the Augustus Long Hospital, members of the media, our vaccine recipients, a pleasant good day. I am Candice Alcantara, Manager of Corporate Communication at the Ministry of Health, and I will be your Master of Ceremonies for this very brief ceremony. On behalf of the Ministry of Health and all of the regional health authorities, I welcome you all to this milestone activity, which will signal the beginning of the deployment of the COVID-19 vaccine in Trinidad and Tobago. And we go straight into the program. I welcome to the podium now one of the hardest working men in Trinidad and Tobago, the Honorable Terence Dayal Singh, Minister of Health.
Davlin is also one of the hardest working in Trinidad and Tobago. Good afternoon, all. Today is Wednesday, the 17th of February. I want to contextualize what we are doing today in terms of a journey, a trek, or odyssey. You and I, media, health team, led by the Honorable Prime Minister, and all 1.4 million good souls of Trinidad and Tobago, started a journey in about February last year. A journey that we'd never anticipated that we would have to embark upon. A journey that has seen lives ruined. Over 2 million people around the world have died. That is 2,000 families in mourning. We have seen economies ruined across the world. We have seen industries laid bare. Everything to do with travel and tourism, whether it's airlines, cruise ships, hotels, conventions, nightlife, bars, clubs, entertainment. We have seen those industries, unfortunately, take the heaviest impact of this coronavirus. What we have been successfully doing over the past year is managing the virus. And how have we done that? By engaging in physical boundaries, physical barriers like masking, closed borders, social distancing, washing hands. All those are physical activities to manage the virus. Sometimes when you are managing something, you may win today and the virus may win tomorrow. Our darkest days were in September when we had community spread. But since October, the management strategies have borne fruit. Today, our rolling 7-day average moves between 4 to 6 per day. That is one of the best numbers in the world. And it is testimony to teamwork by 1.4 million people, led by the Honorable Prime Minister. And for that, we must give thanks to the population and the Prime Minister for his leadership. But we cannot go on forever managing the virus, because we would like life as we knew it in January 2020 to return. And what do I mean by that? I miss seeing and hugging and kissing my son. If I see my son once a month, that's often, and he lives here. I haven't seen my daughter now for 2 years. She's in England. Many of you would like to visit your family abroad. Many of you would like to go to your grandfather's or grandmother's or RJ and Arja's birthday party, but you can't. Or you ought not to go. Many of us would like to engage in nightlife, but there's a party cruise, carnival, Christmas, Diwali, or Eid. But these physical measures will not take us to that place. What will take us to that place is controlling the virus, where we have dominion over the virus. And the best way to do that is by employing a tried, proven, tested, old remedy used in the modern era since 1796, when the first smallpox vaccination came out, discovered by somebody called Edward Jenner in 1796. It is because of that smallpox has been eradicated. It is because of polio vaccinations that people who take the vaccinations don't get polio. I would have invited former Minister of Health, Mr. not Fuad Emmanuel Hussein, who couldn't get a polio vaccine back in the 1960s and contracted polio. And he was testimony to what he had to go through as a polio survivor with multiple operations to take muscle from his arm and put it here. He spent a year in ICU. He spent 2 months in an iron lung machine. Vaccines work. Vaccines are safe. More people die every year from taking paracetamol, aspirin, and ibuprofen than vaccines. So today, I am so heartened. I am so proud of our healthcare workers, 100 of them, who have decided today is the day they are going to lead this country to take control of the virus. Let's give them a round of applause. These 100 healthcare workers are telling the country and telling their co-workers, I have confidence in the vaccine. I am sure this is the way to go. And I am going to be a leader. And today is about leadership. Today is about leadership. And these 100 healthcare workers, whether you're a doctor, a nurse, you ought to be heartily, heartily congratulated. Because whilst we recognize there will always be the vaccine skeptics, by this 100-person showing today, you are telling the country that you believe in the science, that you don't believe in myths and superstition and old wives' tales. Let me just rewind to the 1990s briefly, so members of the media who are listening will understand where the modern era of vaccine hesitancy started. And it's a pity it was started by a doctor. His name was Dr. Robert Wakefield. He did a study, so-called study, of 12 children with autism who coincidentally took the MMR vaccine. And he then made the link. He jumped to this wild conclusion, totally unsupported by data or evidence, that the MMR vaccine caused autism. It was later found out that he was being backed financially by certain companies to start up this rumor so that you could have testing done for autism, and he was going to control the testing, and he was going to make money out of this. Dr. Wakefield was subsequently struck off the register of physicians in the United Kingdom. He is the father of the modern anti-vaxxers movement. He has been totally discredited. So the message today is, believe in the science. Believe in your co-workers today, all 100 of them. To date, over 150 million doses of all the coronavirus types have been administered around the world without any serious side effects that can be linked to the vaccine. 150 million. But in the United States every year, between 3,000 to 16,000 people die every year taking ibuprofen, which many of us swallow like candy. Which is more dangerous? Right? So, I just want to thank everyone for coming out here today. Today, we draw a line in the sand and tell the virus we are in control. And if we get enough of the population to take the vaccine, the day will come, I promise you, when you can hug your grandfather, go to a party, and life could return to what we knew it in January 2020. Thank you all very much for coming out today, and may God bless each and every one of you.
Thank you very much, Minister Dayal Singh. And before we go into the actual vaccination exercise, I'm going to give the opportunity for question and answer segment at this time. Just to let you know the persons at our head table. Of course, the Honorable Terence Dayal Singh, Minister of Health. Betty Ann Pilgrim, Nursing Administrator at the Ministry of Health. Davlin Thomas, the CEO of the NCRHA. Dr. Don Martin, Medical Chief of Staff at the Cuba Hospital and Multi-Training Facility, and Dr. Stanley Giddings, the Medical Chief of Staff at the Augustus Long Hospital. So we're going to put the mic in a position right here so that members of the media can come up to the mic and ask the questions. Okay? Thank you. Okay, so we seem to have no questions. We'll go into the vaccination activity.
Sure. Okay.
Good afternoon, Urvashi from TV6. Just to find out who is the first person elected to get the shot today. And of course, we remember the Prime Minister said that once the vaccine is here, he'll be the first. And you said, of course, he'll be the second.
Correct.
Just to find out, just follow up on that
Sure.
when.
So I have no idea who is going to be first. On the principles of equity, the minister doesn't choose people. That is left up to them. But it's going to be a nurse. On the question of whether I will be taking the vaccine, the Prime Minister, as I said in the press conference this morning, because we only got 2,000 and we are starting with 2,000, it will be, in my view, irresponsible of me to take up one of those few precious doses which could go to a frontline healthcare worker. I don't want it to be said that a frontline healthcare worker contracted it, died, and that one dose could have saved their life. I will take it when the 120,000 batch comes in, so we have larger numbers to play with. And so I will be taking it then, and hopefully the PM will be taking it then.
So I'm not sure who will be able to, if now or after, but just to get a little background on that person, why he or she would have been chosen, and why they decided to take it first, if it's possible after. Or?
Davlin.
Okay, sure.
Well, essentially, when the threat of the virus unfolded, there was a particular group of persons called IPC nurses. Those are infection prevention and control nurses who had to engage directly and are still doing so to ensure that they became the barriers between infection and the personnel and then by extension the community. those persons have been chosen to be the first to be vaccinated. The first person would be Miss Keisha Privat Gomez.
Oh, okay.
Yeah, and she told us. So if we quote the minister, IPC is frontline, frontline, frontline.
You can't get any more frontline than IPC.
And Minister, as a follow-up question, given that this first batch that we're receiving came from the government of India indirectly, given our diplomatic ties with India, how come we have not approached them, or have we approached them, given that they have, stated that they'll be assisting in vaccinating the world, not just India?
So the government of India has been approached by the Minister of Foreign Affairs. So those bilateral talks are, in fact, proceeding and proceeding nicely.
Good afternoon, Minister.
Good afternoon.
Binama here from ITV News. Well, Irvish, you just took my first question, so thank you in advance for that answer. Can you give us an update with our vaccines itself? I know we're set to receive it, so can you just give us an update on that, please?
So through the COVAX facility, according to PAHO WHO, and you would have seen Dr. Erica Wheeler at the ministry's press conferences, we will be receiving, according to them, all things being equal, 100 to 120,000 doses sometime between the last week in February to the first week in March, which is just about a week, 2 weeks away, right? So we hope to flow seamlessly from this 2,000 into that. So once we finish with people like Nurse Privat, the frontest of the front line, then we go to other healthcare workers, then we go to people in our NCD clinics, then we come down the list to essential workers. Essential workers will be people like teachers, police, and then we come into people like parliamentarians then, right? We will consider parliamentarians essential workers because you do want your parliament to continue functioning, right? And that's the hierarchy. And then hopefully, when more and more doses become available, you make it available to the wider public, right? But the COVAX, let me just reiterate, the COVAX facility talks about vaccinating 20% of the world population within 1 year to end what is being referred to as this acute phase of the pandemic. So the vaccination program is going to continue for a while. It's going to continue for a couple of years. This first tranche of 100, 120,000 is our first tranche of that 20%. Okay? So that's a more complete answer. But let me just give you some more information. We are pursuing the purchase of vaccines through a CARICOM initiative, where we partner with the African Medicines Council, AMC. Through that initiative, Trinidad and Tobago is registered as a recipient of vaccines. What has been allocated to us in that platform outside of COVAX is 226,000 doses of vaccines across 3 vaccine platforms. 1, AstraZeneca, 100,000 hopefully. 2, Pfizer, 100,000, both of which have received WHO emergency use authorization. And 3, the one that is the only one-jab vaccine, the Johnson & Johnson vaccine. That we have been asking for roughly 26,000 of that. But the Johnson & Johnson vaccine has not yet received WHO emergency use authorization. Okay? And then we are pursuing bilateral talks with Johnson & Johnson, with AstraZeneca, with Moderna, with Sinopharm, and then we are also pursuing talks with the government of India and the government of China. Right? Any other questions? Yes. Would it be mandatory to what? Sorry? Just go and speak in the mic for me, please. And if you could take off your mask. Right, Kiboy.
Hi, good evening, Minister. Good afternoon. I just wanted to find out, once more vaccines become available, would it be mandatory to take once the borders open back out to travel?
Okay, so the vaccination program is not mandatory for anyone. It's strictly voluntary, but it is highly recommended. The government cannot force, mandate, or legislate that anyone take the vaccine. So it's not mandatory, but it's highly recommended. For travel, the jury is still out. So for example, right now, if you want to travel to a country like Jamaica, like India, you must provide proof of yellow fever vaccination. And that must be stamped in your international vaccination card. So there may be countries that say if you want to come to them, you must be vaccinated. Then you don't have a choice but to be vaccinated, or you don't go to that particular country. But that's the only mandatory aspect of it. But right now, the jury is still out whether countries that you want to travel to are going to mandate this. Any other questions?
Yes, Minister, we have 2 more questions, but I just want to advise that after these 2 questions, we go to the vaccination location where our EPI manager, Grace Sukhchand, I know she's ready and prepped, will administer the first vaccine, the first COVID-19 vaccine in Trinidad and Tobago to Keisha Pravat Gomez, infection prevention and control nurse based at Cora Hospital of the NCRHA. So I'll ask Mr. Khan to come forward.
Hi, good afternoon, everyone. Rashad Khan, Guardian Media Limited. Okay, so Minister, vaccinations has been lauded, and even you this morning yourself said that this would help us return to some sense of normalcy in the long run. So now my question to you is, what is the level that the ministry is going to be pleased with the population being vaccinated before any advice is given to the Prime Minister to probably roll back on some of these measures which we are taking now? Is it that we're going to wait until we've achieved herd immunity?
Okay, so that question has been tackled before, and the answer is this. There is no one metric, there is no one figure or magic number we are looking at. Before life goes back to normal, the decisions are going to be based on a series of metrics. 1, the R0 number, which is for every 1 person who has the virus, how many people do I infect? Internationally, Dr. Giddens could tell you, and he could talk about R0. Once your R0 drops below 0, it means you are controlling this virus more. So that'll be 1. 2, we have to look at fatalities. Are we still seeing people dying, even though case numbers are low? Then you look at your Dublin rate. Is your Dublin rate to move from, let's say, 100 cases a day to 200 a month or 2 days? So you can't look at your numbers alone. You look at your rate of increase. So it's a whole series of factors, and I have no doubt that the vaccination rate through the population will play a factor. But as I said, the COVAX objective is to vaccinate 20% of the global population within 1 year to end the acute phase of this pandemic. I don't know if Dr. Giddens wants to talk a little more about the R0 number.
Hi, afternoon, everybody. Just as the Minister mentioned, that will be one of the factors that you will have to use in terms of determining when we have achieved sort of adequate vaccination and herd immunity. And it would sort of vary based on the vaccine component, the efficacy and the effectiveness in the population based on the studies. And once we factor all those metrics in, we'll be able to determine what level of immunity would be present.
So it's a very complex formula that we use. Okay, any other questions?
Good afternoon.
Good
Ian
afternoon.
Mason from Rhythms Communications Network. For the sake of clarity, because I'm not sure what is the case, I know this is an arrangement between the two Caribbean islands, Trinidad and Barbados. They gave us 2,000 of their supply.
No. The government of India made a gift to the region using Barbados as a central depository.
Okay.
From that, we got 2,000.
Okay, good. Okay. Because I was getting reports that it was from Barbados supply, so I just wanted that clarity.
No.
All right, thank you.
You're welcome. Right.
Thank you. So thank you very much, and we're ready to go into the actual vaccination now. Just to let you know that we have two persons that will be highlighted this morning. So the first is our infection prevention and control nurse. The second recipient this morning will be Dr. Don Martin, who is the medical chief of staff right here at the Cuba Hospital and Multi-Training Facility. And his colleague, the GM Nursing at the North Central Regional Health Authority, will administer the vaccine. That is Ms. Deanne Hinney. So we invite members of the panel, if they'd like to get closer to the action. And we give the cameras some time to get themselves situated. Is everyone ready?
Please sit down.
So just making sure that you have the names. This is GM Nursing at NCRHA, Deanne Henne, and she will be administering the second COVID-19 vaccine in Trinidad and Tobago to Dr. Don Martin. And Nurse Henne will stand in a position to give you a good angle. I know this is happening on the other arm, and so Nurse Henne will angle herself just a bit to give us the best photo opportunity possible. A little more angled if possible. Dr. Martin, please stand and let's angle your chair a bit this way so that nurse can, and bring it forward just a bit. No, the other way, sorry. Right. Or bring it forward. Oh, my bad, sorry. Right. Okay, hold a second. Sir? 1 second. We need Dr. Martin. Just stand again, sorry. We want to make sure, so we need you a little further behind him, if that's possible. Now, this is a clinical activity. Yeah? It's most important that we follow the clinical protocols. We'll try to give you the best image possible, yes. And both our recipients this afternoon will remain in observation for the allotted time. Okay, so both of the recipients will remain in observation for 30 minutes from the time that they received the vaccine. Just wanted to say a special thank you to our panelists. Special thank you to the team at the NCRHA. Thank you to the team at the Ministry of Health. And of course to our 2 vaccine recipients and vaccine administrators. And just to mention, we have some other members of staff who received the vaccine.
Hi guys, how is life under lockdown? Are you getting used to it? Are you bored, lonely, feeling low? If the loss of your normal life is hitting you, know that you are not alone. Here are 5 simple ways